This video, titled Non-invasive surgery for a sprained ankle, is an excerpt of a presentation which was done at the Meiji University of Integrative Medicine in 2006 in the Inter-Japan Congress of Judo Therapy. A sprained ankle is one of the most common injuries encountered in a clinic. In this presentation, we will introduce you to a new approach to treating a sprained ankle and emphasize its effectiveness. According to the conventional concept, a sprained ankle is considered to be an injury of the ligaments around the ankle and is evaluated by the amount of swelling or internal bleeding. Furthermore, orthopedists favor conventional treatments, for example RICE, rest, ice, compression, and elevation, although they are not effective. According to the new concept for treatment for musculoskeletal injuries, which we call facial distortion model, FDM, it has been proven that there are some substantial alterations in the connective tissues which are damaged by external forces, and they are able to be corrected immediately by manual methods. According to conventional thought, it might be difficult to accept this, but we, FDM practitioners, can completely demonstrate this. And furthermore, once the tissue is corrected through FDM, it regains almost perfect function and strength in most cases. So, let's demonstrate this through some clips of case histories. This is a clip of a patient being treated for a sprained ankle. He was treated one day after his injury when it occurred during a basketball practice. In this clip, swelling is apparent, which indicates a second or third grade sprained ankle. Although this swelling persists after treatment, the patient recovered as he was able to hop after only 20 minutes of FDM treatment in one session. This patient, before visiting an FDM clinic, was diagnosed with having injured ligaments, which might have been torn. He was advised that at least 3 weeks of rest and rehabilitation were needed and was given a cast, crutches, and cold packs. Furthermore, he was advised not to play sports. However, despite his serious condition, we were able to correct the tissues that were damaged. Furthermore, the patient regained normal function and athletic performance. So, the difference in results between FDM and conventional methods are obvious. This patient was able to play basketball after this first session and completely recovered with 3 sessions. According to FDM's concept of a sprained ankle, it is thought that substantial alterations exist in the origin and insertion of the injured connective tissues around the ankle. Some part of the bone elements are forced into the ligament by excessive external force. Consequently, there is damage to the normal arrangement of tissues. However, these alterations are possible to correct manually by reversing the direction of the physical forces which damaged the normal arrangements. It is possible to perform immediately and produce obvious effects like these alterations in the video we just saw. Therefore, this treatment brings about immediate recovery and greatly shortens the healing time. Let's demonstrate the effects of FDM with some other videos. This is a case where a high school student, during his volleyball practice, sprained his ankle just a few hours before going to an FDM clinic. When he came to the clinic, his ankle had considerable swelling and fever. He was limping and lost almost all normal functions in his foot.
いつ年出した？
今日の午前朝です。
朝。
However, after only 20 minutes of FDM treatment, he regained normal functions and could join his afternoon practice. This demonstrates that the injury was resolved perfectly through the manual techniques of FDM. This woman suffered a sprained ankle in a hockey game 3 days before visiting an FDM clinic. She was diagnosed by an orthopedist with having injured ligaments, which might have been torn. She was put in a cast and given crutches and advised to get rehabilitation. The orthopedist just gave her a cast and packs and advised her not to exercise. However, after active FDM treatment, as you can see in this clip, the patient recovered immediately and regained sufficient functions and strength. The treatment eliminated the symptoms and remarkably shortened the healing time. This clip shows a patient who sprained her ankle inwardly and had a stable fracture of the 5th metatarsal bone. It is highly common for such a sprained ankle to need 4 or 5 weeks to recover, using crutches and a cast. In addition, it'll take about 3 to 4 more weeks of healing through rehabilitation. However, as the patient hoped to take part in a volleyball game in 1 week, she had 1 session of FDM treatment and recovered to some extent. Following that, the other 3 sessions cured her completely. As a result, she was able to play volleyball. These clips I have shown prove undoubtedly that FDM treatment is efficient and the efficiency is sustainable, because traumatic injuries where there are damaged tissues can be corrected by reversing the forces which affected the tissues. So, ultimately, the recovered tissues are completely healed. In short, they regain their original and normal functions. This process is called healing. It is believed that sprained injuries recover in 3 weeks, or pulled muscles recover in 3 weeks. However, is this truly the case? The fact is that those patients probably gave up on conventional methods of treatment. From the FDM perspective, just casting the symptomatic area and leaving the patients as they are is not called treatment. FDM practitioners often hear from patients that they would not go see a doctor since doctors can't cure their injuries completely. This is evident by the fact that sprained injuries are not completely healed, as the deeper symptoms are not treated, thus leaving the injury untreated and open to reoccur multiple times. Obviously, this reoccurrence is due to the insufficiency of the therapeutic methods. Furthermore, the term reoccurring injury is misleading because the injury was never properly cured in the first place by the therapist. As all of the other scientific fields are in the process of advancement, we too should embark on discovering progressive methods in the fields of treating musculoskeletal injuries.